Good afternoon. I have two members of Local 79 who are frontline workers joining me, but because of the back and forth of the agenda, hopefully they'll appear during my deputation and come right after. But we're really...
It's material to you. We do have two other people, and that would buy you another 10 minutes, but it's up to you entirely. I mean, we have two other people that are also deputing. Right. Or maybe are they the same people? Fred Shilson and Laura Aversa, are they yours?
Those are the same people I speak
Oh, fine. Okay, then. Right. Okay. Thanks.
And Laura is a recreation worker, and Fred is a cleaner in long-term care.
Could I just ask before you speak, there's a bit of hubbub in the room, and we could just keep it down a bit. Mr. Maguire has some things to say, so we want to hear them. Thank you.
I appreciate that. So I've been at Budget Committee and at Executive Committee for talking about the very exciting topic of variance reports. Not a lot of people come to depute on them, but we think it's very important to look at these reports and look at the impact of gapping on staff and on the services they provide. And we've started a workplace campaign over the last number of months to talk to our members about workload that arises as a result of gapping and the impact on the work that they do. So, as I said, two of our members delivering services in recreation and long-term care will be here to speak soon. But from our perspective, gapping has become a chronic challenge in this city, with 3,200 positions vacant right now at a rate of 5.8, even though the official rate is 2%. Long-term care and recreation's only gap at the average rate around 5%, but still it's above the target. In ECS, gapping rate of 10%, construction services. The division is supposed to make sure that the physical infrastructure maintenance of buildings happen efficiently with little disruption to commuters, businesses, and residents. It's hard to do that when we're 60 staff down. The last 3 years, the city has set targets to reduce gapping and missed it every time. Council directed staff last spring to report back to Budget Committee prior to the budget launch on strategies to address the city's vacancy rate in a sustainable manner. In the context of the 2017 budget and the very serious discussions that are happening around the long-term fiscal situation of the city, we think the city needs to come up with strategies to deal with gapping and the impact on pressures on workload and service delivery. We think that it's important that the city have aspirations to build, repair infrastructure, build new infrastructure, It's okay. Thank you. We think it's important for this city to have grand aspirations, to fix aging infrastructure, to build new infrastructure, to have new projects. At the same time, it's important for us to have aspirations to maintain important services like childcare, social housing, the services that we're about to hear a representation from. We can do both. And we think that we need to find, as we go through the 2017 budget and the long-term fiscal discussions, measures, strategies to ensure that we do both. And we have to maintain those services by maintaining bodies doing those services. In the members we're talking to in our campaign, we're hearing important stories about the ability of members to do, city workers to do to perform the services they are hired to provide. So, they will introduce themselves and make a few comments.
Sure.
Thank you.
Welcome. Please go ahead.
My name is Fred Shilson, and I've been a cleaner in long-term care for 9 years now. All of them have been spent being part-time. I've worked hard while I've been there with the city so I can build some stability in my career. I came to the city because, I was proud of the record the city had with regard to its social services. It was the gold standard for how organizations should be run, and I thought I'd have a full-time job with benefits and a salary within a few years. I have many of my coworkers in long-term care have been with the city over 20 years and have no realistic expectation of getting a full-time job. My position is a cleaner heavy duty. I strip and wax floors, move equipment, deep clean the environment, resident rooms, bathrooms, and ensure the residents have a safe environment to live in. This is getting harder and harder to do. At present, there are 115 positions in long-term care that are vacant. There aren't enough staff to take care of the residents and make sure health and safety issues don't arise. I'm not sure if you're aware, but long-term care has one of the highest rates of LTD of any division in the City of Toronto. Our buildings are older, and like a lifetime of sun, fun, and cigarettes, they're starting to show their age. As a cleaner, I've seen the impact of your cuts up close. We have less people and less time to do the work, we aren't able to keep up. Here's a startling number for you. From 2012 to 2014, 34,700 shifts weren't filled in long-term care. My home, Castleview Witchwood Towers, had a whopping 10,536 shifts that weren't filled. This means that my residents did not receive the care they need, as our personal care attendants had 1,728 shifts that weren't filled, registered practical nurses had 1,571, and registered nurses 715. In the building services department itself, there were over 3,700 shifts that weren't filled. This correlates during the same time period the Castleview Witchwood Towers had an increase of longer-lasting enteric outbreaks, according to the Ministry of Health and Long-Term Care. This means, and I really want to stress this for you, that it means my residents were and continue to be put at risk. Many have very complex medical conditions and or compromised immune systems. By cutting back on the cleaning, which means you think, oh, it's not really that much of a big deal, garbage can get picked up later. You're getting longer and more complicated enteric virus outbreaks in all 10 of your long-term care homes. There have been more enteric outbreaks in the last few years, which include bacteria and pathogens that get transferred through infected surfaces and lead to intestinal illnesses, vomiting, diarrhea. You know how this is going to go. Just to note, when we have an outbreak, it ends up costing more money in the long run, because you have to include extra staff to come and disinfect the units. One nurse can be in charge of a whole building during a night shift, responsible for 467 residents. And the problems don't just stop because it's nighttime. This name might not be recognizable to you, but to my colleagues, it's the starkest reminder of what happens when we are short-staffed. On November 8th, 2013, Francisco da Silva was found in his bed by a staff member, murdered by his roommate. Without getting into specifics, this is a clear-cut example of how your changes are impacting resident care. Maybe if we had more time to speak to his roommate and understand his illness, this wouldn't have happened. Maybe if we had more time to take care of Mr. Da Silva, this wouldn't have happened. Maybe if we had more time to check his roommate's medication, this wouldn't have happened. The City of Toronto as an organization has completely and utterly failed these two individuals and their families. The staff are doing their best to try and fill in the gaps. Personal care workers sometimes take over the duties of RPNs, registered nurses, and sometimes PCAs and laundry. Everyone is doing the best that they can under the circumstances, but it isn't safe for these workers to be doing duties that they weren't trained for. The City of Toronto has eliminated the shift overlap for our nursing departments. What this actually means is that the City of Toronto is forcing our nurses to stay after their shift without pay to ensure the oncoming shift knows what happened on the unit. This means more times away from their families, less time for resident care, and less time to contribute to their communities. This is a loss to all of us in the City of Toronto. Lack of staffing is also hurting long-term care's ability to get proper funding from the province. Here's where it gets interesting. A personal care attendant provides direct care to a resident, and for each piece of care they do, it's reflected in something called the NCPR, which is a log of the resident's needs. We can also spot cognitive decline over time and develop a care plan for the resident, spot changes early, and slow the progression of the disease. The NCPR is then inputted into a RAI MDS system to be sent to the province to determine the Case Mix Index, or CMI. This CMI is based on things like demands of care, cognitive abilities, how often they're toileted, etc. If we were budgeted for 34,700 shifts to be filled based on the CMI, and according to what we received during bargaining, these shifts weren't filled by reasons of not needed, and this was determined by a manager, where did the funding go? Because of these issues, Local 79 is doing a much more extensive member engagement process as part of our Labour Management Committee to address some of these issues. But if these vacancies continue and issues continue to not be addressed, our options are limited. Thank you.
Thank you. I'm next going to call on Ms. Aversa. Did you want to make some comments as well?
Yes, please.
Thank you. I sort of treated this, I think you were listed in fairness to you as 3, and you came up here as 1, and I'm treating you as kind of 2.5 or 3, but you go ahead, Ms. Aversa, and make your comments. Thank you.
Thank you. Good afternoon. My name is Laura Aversa, and I come from the Parks, Forestry, and Recreation Division. I grew up going to city camps in Etobicoke, and once I was in high school, I decided to fill my volunteer hours in recreation. I got a job 1 year after as a camp counselor, and at that time it was the perfect summer job. I got to help kids grow up the same way I did within recreation. I've worked in recreation now for 7 years, and I'm trained to do a variety of job classifications: camp counselor, facility in charge, sports instructor, just to name a few. I absolutely love my job and love the families that I'm working with right now. There are two major impacts I see from the 229 vacancies we have in recreation. There are huge wait lists, especially in facilities in Etobicoke where I work, and these are low-income areas where the families really need these programmings. I know we have implemented a new registration system to try doing better to have participants actually register in programs, and that is welcomed. But I can tell you firsthand that we still don't have enough programs to help the extensive wait list that we have in these low-income communities. The second major impact that is there are the part-time workers becoming full-time workers in recreation. It takes on average about 10 years of a part-time worker working 40 hours a week to even be considered for a full-time position in recreation. A bounce from center to center, program to program, to put together 40 hours a week. I love what I do, and it's definitely very difficult to make a life out of it. But right now, it's just a part-time position.
Thank you very much to all three of you.